afternoon. Just wanted to go over today a little bit about what is the current state of COVID-19 here in Bexar County. And I think it's important that before we do that, we talk a little bit about what has happened with COVID here in our community, and also go over like how are we measuring the level of COVID in our community, and how can we explain that to other individuals. I think as community health workers, you all have a very important job, and that is our communication and our connection to the community. So making sure that you all understand how we use this data and what the data mean, so that you can answer questions and you can also be our voice out there to make sure accurate information is being given to the community. So we'll go over as well how to interpret some of the data and some of the graphs, and then finally review what is the current status of the pandemic here in Bexar County. As Raquel stated, we do want this to be communicative, so please feel free to ask any questions as we go along. That way we can make sure there's clarity amongst all. So evolution of the COVID, I don't know, maybe by a raise of hands, how many of you all thought we'd still be dealing with COVID, almost 3 years later? I surely did not. I thought it would be very different, not necessarily that it was over, but perhaps not as drastic and impact our community as it has. But this all started back in January of 2020. I still remember getting the phone call saying, we're going to have some planes landing here with individuals from Wuhan. We have to get ready and get set up. Before we knew it, CDC was here as well, providing some assistance. Our laboratory was getting ready to be able to test locally. And then it just kind of seems like a blur. It evolves from there with so many different changes happening over time. Then one of the things that happened with COVID that we haven't seen with some of the other infectious diseases, even when H1N1 happened, we rapidly became a vaccine available, back in December of 2020, that would help us combat this pandemic, yet not necessarily end it, but another tool that we could add in our toolkit. And the vaccines have evolved, since that time frame. And really, when I was looking at the timeline today, we have to add that there's now a new bivalent vaccine that just came out, I believe, over Labor Day. So, we continue to learn about this pandemic and about this virus, and we also continue to adapt to it to hopefully minimize how severe it impacts our community and the individuals in our community. So a little bit about what we will go today is about the terminology, making sure that we understand the data and how to describe the data to others. And in epidemiology, we use an epi curve. That is something that no matter what disease it is, we're going to display the data to see what's happening. And so that's really looking at the dates of when the disease occurred with individuals that are either associated with an outbreak or a cluster of cases, to see, are we having a peak? Are we having a decline? Have we reached the peak and now seeing a decline in cases? And then another term that you'll see often used is event date. And that event date doesn't necessarily mean one thing. It could mean many things, but it's the date that we associate with that illness for that particular individual. And ideally, we try to get the onset date, so the date when symptoms started for that person. But sometimes they may not know, right? It could be it could be like with COVID, where they don't have an onset date because they're asymptomatic and they test positive. So in that situation, it would be the date of collection. And then for other individuals, it could be the date of when symptoms got worse. So it's not always necessarily uniquely the same, but more or less is ideally when symptoms first started, or if they didn't have symptoms or we're not sure when the symptoms started, then it's typically the test date of when a lab specimen was collected. And so this curve is COVID-19 of our data showing from about June of 2020 through April or May of 2022. And you can see that the orange bars are the number of new cases reported, again, by event date. So either by the date when their symptoms started, or we got a test date if they didn't have a good onset date of when symptoms started or never had symptoms. And then we do the blue line, which is kind of gives us the average number of cases. kind of gives us a smoother line. But typically we use the daily new cases to say, are we peaking? Have we reached the peak? Are we now seeing a decline in cases? So you can see the first peak that we had back kind of in the summer of 2020. And then you see the next peak that was more in the winter of 2020 into 2021. And that was, I believe, still when we started with the Delta. And then we had some of the vaccines come, and we were kind of flatlined for a little while. So not seeing, still having cases. We've never not had any cases in our community, but just not as many cases as previously. And then we had the next surge that occurred in the summer of 2021, kind of through the fall, which was also a Delta. And then you see this large peak here, which was, does anybody know what caused this peak here? It's the Omicron, the latest variant that we've had in Delta. So you've seen that that really impacted our community. And so that's how we use these, not only to see what's happening, but we can also use to predict what trends are we going to see in the future. So looking at the different peaks over the years, it would give us a hindsight like, okay, guess what, folks, we were probably coming up against another peak if history repeats itself. So it just gives us time to prepare, to make sure we're educating individuals, to make sure we're reminding them it's not too late to get vaccinated. And if you haven't had your booster, please go get that booster, because we're starting that fall winter timeframe. And it's really a good time to get vaccinated, especially with the new bivalent vaccine that has recently come out. And we also try to remind people that this time period, it's not just COVID, but flu season is upon us too. So a good time to remind folks to go out and get their COVID and their flu vaccination. And so here, you might have remembered in the beginning, we were monitoring kind of the amount of COVID and the risk level in our community. And we were using various factors for that. And there was some discrepancies with what CDC was saying, because CDC might say we were in red, that our risk to our population and to individuals was very high. But we here locally were using different factors, and it was saying green. So we were not as high. We thought we were safer in our community. So to align, we did decide to look at how CDC was moving forward, and they have changed to more looking at the COVID community level. And it was a way to measure how much impact COVID was having on the community, and it can help align what actions should be taken. I mean, we can't be in red forever, I think, is one of the issues, because then there's no hope for individuals. We also realize that cases are going to continue to occur. Remember, vaccination isn't to prevent all disease. Vaccination, I mean, we hope it would prevent disease, but really vaccination is geared at preventing severe disease, hospitalization, and death, especially in those individuals who have a lot of multiple underlying conditions. We also know that things are different because we have high vaccination rates. So that may also decrease the severity of disease in the community. And these community levels are really geared at helping individuals to make decisions for themselves and their family members based on how much COVID is out in our community and what is the stress out in our community. So to align with the CDC, we have now chosen 3 indicators, and these indicators are put out every Monday or every Tuesday on the website to let us know where we're going. And we'll talk now about these 3 indicators. The 3 indicators, the first one is the weekly case rate. The second one is the weekly COVID-19 admissions to the hospitals. And then the last is the weekly percent of staffed inpatient beds occupied by COVID-19 positive patients. And then I'll go into a little bit more detail about these 3 indicators. But first, I kind of wanted to back up and talk about what is a rate and why do we use rate versus just numbers. And what I always like to explain to people is that with the rate, we're able to normalize it or standardize it so that we're talking about the same, and we can compare against geography, against location, against different populations. And it's really standardizing that measure or equating that measure. So for example, let's just say we were wanting to compare Austin to San Antonio to Houston, where Houston has a larger population. If we use just numbers, saying there's 100 cases of whatever in Houston, 100 cases in Austin, and 100 cases in Bexar County, that doesn't necessarily mean the same thing because the population is so much different in those three cities. So to be able to compare one to the other, we calculate the rate. And that rate is calculated by taking the number of individuals affected. So in this case, we're using 100. That would be the numerator or the top number when you're looking at doing division. The bottom number would be the size of that population. So you would, for each one, for Austin, you would use the population, total population for the denominator there. Houston, you'd use the Houston population. And then here in San Antonio or Bexar County, you would use the population in Bexar County, times that by 100,000 population. And now we could compare apples to apples versus comparing apples to oranges and knowing, is it affecting one population more, one community more so than the other. And so this is just the formula for how you calculate that case rate. So for the way that we do it for COVID, it is the number of new COVID cases that occurred in the county in the past 7 days. So that is our numerator, divided by the population in the county. And then that's multiplied by 100,000. The population in the county that we use, it's over 2 million. So that is how we get that rate number. And I'll show you what that number is a little bit later. The hospitalization rate is also calculated in a similar manner, where we take the total number of new admissions of patients with confirmed COVID-19 in the past 7 days. So that's a total number, not just 1 day, it's not an average, but for that whole week. And then divide it by the population in the hospitals for that trauma service area. So we're in what is called trauma service area P. And you might wonder, like, well, where do we get this data? We have the Southwest Texas Regional Advisory Council, and they're an organization that works with all the hospitals to collect this information. So that's how we get that information on a daily basis. And then we take that number and multiply it by 100,000 population. So looks like I have my comma in the wrong spot there, so I will fix that. But that is basically how we calculate that hospitalization rate. And then lastly, it's the percent of staff inpatient beds that are in use by patients with confirmed COVID-19. Again, this is data that comes to us through STRAC, the Southwest Texas Regional Advisory Council. And this one is a little bit different than the other two because it is an average number for the past 7 days. So what is the average number of staffed beds? That means it's a bed in the hospital and there's staff that actually could work that bed, not just the total beds in that hospital, and that they're occupied by patients that have been confirmed to have COVID-19. And then that's divided by the number of staff beds and then multiplied by 100 to get the percentage. And so you might ask, why do we have so much with the hospitals, like with the staffed beds, as well as the hospitalization rate? And the reason why is that we want individuals to know how severe and are we seeing severe cases of COVID in our community, because then that would put more people at risk. And that's why we've chosen those two indicators to use in the algorithm to determine our COVID community level. So now this shows the kind of the algorithm, if you will, about the different indicators and whether we would categorize our community or our county as having low, medium, or high. The first factor that you look is at the COVID cases, that case rate, and you go either, is that number fewer than 200 or is it greater than 200? And that's 200 per 100,000 population. So if we are lower than 200,000, then we kind of stay up here in this box. If 200 or greater, then we come down here. So you see that if we're at a case rate of greater than 200, then we cannot be in the low community level. We would either be in the medium or high, based on where we're at for the COVID admissions and the percent of staffed inpatient beds. So that's kind of how you determine these. And you have to use the highest level that applies to your community. So for example, let's say that we had fewer than 200. So we're in the upper part, and our new COVID admissions was 10. So that puts us in the medium. And our percent of staffed inpatient beds was less than 10. It would be low. But overall, it would be medium because of those new COVID admissions being in the medium. So whichever level is highest is what sets it for the whole county. It's not that we would say 2 out of 3 or 1 out of 3 have to be in a certain category. It's just whichever one is highest sets the level for that jurisdiction. And then the other question that we get a lot about is, well, why do we have these community levels? And what does it mean for me as an individual? What should I do? What should I tell others to do? And I think this is really important as community health workers to understand so that you can be giving that information out to the public as well. And the way that you can read this graph is that anything at the low level, you would also do at the medium and the high. So you was just adding on activities as you go up the categories. So if we were in the COVID-19 community level of low, we would still recommend individuals get their COVID-19 vaccines and their boosters. We would recommend individuals who have COVID, either they're sick with symptoms or they have tested positive, that they remain in isolation away from other individuals for at least 5 days. Then they could return to normal activities as long as their symptoms are improving and they've been fever-free for 24 hours without the use of medication. We would just ask they mask for those next 5 days. And then for individuals who are at high risk for severe disease, these are individuals that are immunocompromised or have a lot of underlying medical conditions, then we would just say, you know, it'd be a good idea for you to have rapid testing available for you if it was needed, and making sure that they have access to treatments if they were to test positive. In the medium, that for individuals, if we were at the medium level, for individuals who have high risk of severe disease, we would also recommend that they mask while they're indoors with other individuals outside of their household. That way, just to prevent them from contracting the illness. And for individuals that have household or social contacts, friends who are also at risk, that they themselves would consider masking when indoors with others, and also consider doing self-testing, especially before they come in contact with that individual who's at high risk for severe disease, just to prevent any possible exposures. And then lastly, when our community level is high, so in that red level, it would be recommended that all individuals, no matter whether they've been vaccinated or not, wear a well-fitting mask while they're indoors, especially with individuals outside of their household. And then if individuals who are at high risk for severe disease, that they would consider avoiding non-essential indoor activities where they could potentially expose if there's a lot of COVID occurring in the community. And so where are we now in the pandemic? You know, I'm happy to say we're actually in the green. So we are in the low level. We have our admissions rate has declined quite a bit in the hospital. It's now 18.1. Our case rate is down to 65.3 cases per 100,000 population, which has gone down drastically. I remember not too long ago, it was at 200, 300. So that's gone down quite a bit over the last several weeks. And our percentage in the hospitalizations of the staff bed is only 8%. And so that had gone up quite a bit as well recently, but we've now started to see a decline in those hospitalizations. And so although we're in green, does that mean, you know, it's green, good to go, just, you know, go out there, no caution? And I would say no. It means, you know, still take precautions, because we don't want to see this marker go back up into the medium and high level. And just to make sure that all of you know that this data is available on our website, some of the dashboards get updated daily, like our surveillance case numbers. The COVID community levels get updated once a week. Vaccination statistics actually get updated now every 2 weeks. And then our monthly EPI reports, I need to change this, it's now going to be quarterly. So we'll be putting out a report with more information about the pandemic and about the population that it's being affected on a quarterly basis. So I believe in December is when the next report will be released. The overall risk level is also on our website. If you go to the main page of dashboards and data, you'll see that risk bar and where we're at. This was an older image, so it said at that time we were in the high. And the icons for like the new admissions, case rate, and hospitalizations, those are also color coded to the levels. So if it's red, we're in high. If it's yellow, we're in medium. And if it's green, then we're in low. And I think that's all I have for this afternoon. Happy to answer any questions.